dental implant cost. I mean, price questions must come up all the time. So what affects the cost of dental implants to get a brand new set of teeth?
Of course, patients are always worried about cost.
Okay.
I made a sheet here with about 9 of the most important things that affect the cost of implants.
Okay.
First is the actual implant itself. Costs range from $395 to $1,200 for some of my more advanced implants.
Okay.
So that's why a lot of times when we see advertisements for $395, my dental friends and I start laughing because there's no way that is
So
accurate.
they're just quoting the little implant.
They're quoting the tiny little
Okay,
implant,
okay.
and it's probably not the highest quality implant itself.
So it's misleading in your opinion?
If they're misleading on that implant, what else are they misleading about?
Okay, good.
We want to give patients the full picture. Next is how many doctors are involved. The old way of doing things, or maybe a more expensive way of doing things, is having one doctor place the implant in, and then another doctor put the teeth on, and then another doctor or hygienist cleaning the teeth or your dental implants at a future time. At our office, we do everything all under one house.
Right there. So you do both parts?
You have the same doctor putting the implant in, I'm putting your implant in, and I'm putting your teeth on. So I'm making sure that things look good from beginning to end, so I can be proud of it, so you can be proud of it. We're here together.
Okay, good.
Next is what kind of surgery do you need? So the different types of surgeries can affect costs. There could be bone grafting, different amount of sinus lifts, or just a different amount of surgeries that are needed. Maybe taking teeth out, whatever else. All of this can affect the overall cost for implants.
Okay.
Of course, there's a lab bill. We have a nice local lab that we have a great agreement with, and we pass those savings off to our patients. Next is insurance coverage.
What does insurance cover when it comes to this?
Sometimes insurance can cover as much as $2,000, and that's at the high end. And typically, I don't see much more than overall $1,000 worth of coverage in insurances. And a lot of times, that's mainly just for your basic routine checkups, your typical easy cleanings, maybe some fillings. So a lot of times, insurance isn't covering these procedures.
But people are financing this, you say?
People are financing this.
Okay.
We work with a lot of different lenders to make sure that our patients can get financed and have affordable payments so they can pay for this.
Now, Medicare, Medicaid does not cover this really?
Medicare and Medicaid don't cover this procedure.
Okay.
This is a lot of times with our patients through financing or out of pocket. Next is the type of materials. A lot of times you see those ads for the $395 implant. Wonder what kind of materials they're using. Are they using cheap plastics, cheap resins?
We're talking about what they make the teeth out of?
What they make the teeth out of. They're using a lot of the cheaper stuff, or they might not be telling you what they're using. And if they're not transparent enough to tell you what they're using, probably aren't proud of it.
Okay.
We use zirconia. It's top of the line material, biocompatible. The body likes the material actually, so it's not running away from it, not causing inflammation and infection. And a lot of times, because those companies are advertising such low prices, they definitely don't have any warranty or any maintenance because they're not proud of what they're doing. At our office, we are proud to tell you that we have a warranty up to 7 years for anything that we do because we know what we do will last. The other thing that affects the cost is it snap-in, snap-out dentures, or is it teeth that stay in the mouth that you don't take out?
And you say you could do that as little as 4 or 6 implants to give them like a full arch of teeth?
We can give a full set, a full arch of teeth on just 4 to 6 implants. And finally, there's experience. There is so much that goes into this procedure and into this treatment.
So look for an experienced person.
You want someone that knows what they're doing, that has the proper experience, the proper training, that is able to deliver what you want. And that's why when people call, we can't give them one easy cost because we don't know. We have to find out what's right for them.
So they get to see you on a consultation, then you
We'll
give them a treatment plan.
We'll give them a no-charge consultation, and we will give them a treatment plan right away.